We want to welcome everybody out to today's Aspirational Healthcare Employers Group. We've got some amazing people on the call. Thanks for joining us. I am excited to introduce two amazing presenters, both with tremendous background in behavioral health. And let me tell you why I wanted to set this particular one up. Aspirational healthcare is a behavioral-focused, relationship-based healthcare system. And as you've heard me say, many of you before, the NUCA system of care is the pioneer of that system. And they've done an amazing job of completely transforming healthcare to put relationships in the very front. It really is a behavioral focused healthcare system. And this whole movement of aspirational healthcare is to drive this idea of a better healthcare system across the country. So as we visit with employers, as we share with employers ideas, I'm excited today to introduce a couple of very powerful leaders in the behavioral health space and behavior space, and just this whole idea of making behavior and helping people change behavior and improve their behavior at the foundation. So I'm going to introduce Roxanne first. We're going to have Dr. Ron Kigo second, but it's a pleasure to introduce Roxanne Derhaj, mental health and wellness expert and founder of Roxanne Derhaj Consulting. She has over 20 years of experience as a marriage and family therapist and currently consults with corporate executives on company culture and how to create space for positive health changes in their organization. She just released her book, ROR Plus Return on Relationships. And I had the opportunity and pleasure of actually joining her as a part of her launch just a couple of weeks ago. So Roxanne, again, thank you for being with us. I'm going to let you go ahead and take over.
Thank you, Daryl. So hopefully everyone's seeing my screen. What a pleasure to be here with all of you. It sounds like you're all attended the conference together, and I'm very curious to hear a little bit more about it. So I'm going to talk a little bit today about the concept of ROR, which is basically a compilation of things that I've done in my career. So I was formerly trained as a psychotherapist and started Frontline. I live here in Canada, Frontline with the Metro Toronto Police. And I would say, being privileged to be, in that space allowed me to really understand the trajectory of what people need to be connected. So from the first responder of as a trauma team, all the way up to having the privilege to sit in corporate boardrooms with CEOs and their C-suites, the commonality clearly is always connection. So I'm just going to talk a little bit about what I know about relationships, which is that all of us need to feel psychologically safe. I can say as a person that works a lot with corporate culture, what we know through the American Psychiatric Association is that psychologically unsafe environments, there's a 35% reduction in productivity and innovation. And that translates into a whole lot of money for the US economy, $210.5 billion US dollars to the economy. That's a lot. So if we think about what are we trying to achieve in healthcare or just overall in corporate environments, we're trying to make people feel safe. So what is safety? People being able to show who they are. And if people are not afraid of consequences, there's no repercussions. And obviously, they're able to show who they truly are. And I would say that vulnerability allows people the space to bring their entire selves to work. In my concept that I talk about, and when I work with different companies, I talk about ROR, which is return on relationship versus the return on investment. That being said, I always say that if the ROR is in place, the ROI takes care of itself. So when I work with executives, what I'm trying to do is to have them look at themselves and how they lead. So I've created a concept called the authenticity quotient for leadership. And what this does is it's a benchmark for leaders to look at themselves. So if I inadvertently, I'm aware about how I lead, and I think sometimes, unfortunately, or fortunately, some of us can look at ourselves quite objectively, but sometimes we all have blind spots. I don't know how many people on this call would say that they have blind spots when they lead, but I know definitely that I do. So in kind of my tenure frontline and working as an executive in health and wellness and the behavioral health environment, what I did is I decided I'm going to use my combination of not what I know, but also what I saw, and to develop the concept of what would help a leader connect more to him or herself. And I looked at the concept, which I coined or have used a combination of authentic heart leadership. And in this is the area of the AQL, like I call it, what the leader does is he or she looks at him or herself in these fundamental areas of self-awareness, which is, how do I bring myself to the space that I'm in? What do I value in my leadership? The second is balance processing, which is basically a moral perspective. How do I stay grounded in my space as a leader and ultimately make the best decisions? The third part of the assessment is relational transparency. Do my employees trust me? And I would say that for the most part, sometimes we get what employees want us to hear versus knowing. And there's different methods that you can do that in collecting this information. And then ultimately, do you show your employees who you are as a leader? Do they know you other than just Roxanne, the leader, or do they know the essence of who you are? And how do you recognize your staff? And I think that starts with knowing how you recognize yourself. Sometimes, and I know I've been guilty of that, I might not look at how I recognize myself. I might gloss over that, but ultimately it's starting with yourself. With this AQL, what the leadership team does is they assess their own qualities, and their scorecard goes to, this is where I'm at. But I think what is vitally important is you're looking at the snapshot of, how do I see myself? What's my strengths? And then ultimately my limitations. But then the flip side of the AQL is, how is it that you're being assessed by your teams? How do people, when they look at this same assessment, how do they assess you? And in looking at that, collating that information becomes very, very important, because we all have blind sides. And if you kind of think about your leadership story, when I work with leaders, I say, why did you start doing what you're doing? And I think of myself in my leadership story. I grew up in a little island of Trinidad and Tobago. Grew up in culture that where at times, I was pushed from my family to have a voice, but sometimes within the culture, my voice was quelled a bit. So it was something that I learned very early, that I wanted to ensure whatever career I was picking, that I would use my voice. Hence, ending up going into the field of psychotherapy before going on to consulting. So with the concept of the ROR, when I'm working with culture, it's looking at how is the relationship base within the context of your culture. What does it look like? Is it that people feel safe with their leadership team, with their CEOs? Or is it that they're, oftentimes when I consult, people will give feedback to the leadership team and everything is really, really good. Everything is great. But we see that their short-term and long-term disability claims are on the rise with their leadership team. So there's sometimes incongruence where people are not open to what is really going on. And when I go into work with companies and with coaching, when some senior suite individuals come to me, what I'm trying to do is to really, really drill down about what's going on within the culture. So from a macro perspective, doing an organizational assessment to understand what's happening within the context of the culture becomes key. And then from that, I drill down to work with the senior leadership team. Ultimately, what we're trying to do is to create, obviously, self-awareness for the individual leaders. Then, if you're unaware of how you're leading in those 5 particular areas, how is it that you're connecting with others? What kind of things are you doing? What are you aware that you do well? And then ultimately, what are you not doing well? And then from that, we're looking at your leadership legacy. I often say that the leadership legacy that I'm working to create with leaders is, what is it that's being said about you when you're not at the water cooler? When you're entering a room, would be it a lunchroom when we were all in person, is it that the conversation changes? Are people saying what they think you need to hear about your leadership, or do they continue on to act the same way? So with the ROR, the concept is to look at the entire corporate culture and say, what are the needs of the relationships within the different levels of the organization, and what is it that you can do to enhance it? So if you look at psychological safety, it begins with awareness. And oftentimes I would say with senior leaders, they're very good at the tactical end of things, but sometimes when things get task driven, they might get away about looking at that internal space of coming from a place of empathy. Not that I'm saying leaders aren't empathetic, but sometimes when they're under stress, that may be something that they're not looking at a lot. Growth as a leader is getting uncomfortable with someone's whose personality is diametrically opposed to you. I think for the most part, we are able to connect with individuals that relate to us very well. But my challenge oftentimes when I'm working with senior leaders is to have them go through things like, think of the last time you had a conflict on your team. Who was that individual that you were dealing with? And how did it go? What did you do? What did you do well? What did you not do well? And what kind of things can you learn from yourself? I think oftentimes looking at scenarios that have not gone well is something that helps you grow a lot as a leader. So again, if you think about relationships, and I know with aspirational health, it's all about leadership and connection for outcome. When your team, when you're authentically connected to them, they are engaged. Let your team see that they're understood. Obviously, when you use blaming language, that depletes or lessens trust. Being self-aware and being self-aware and demanding what you need from your team is sometimes not the best tactic, but to be connected to them, to understand, if there's negativity, you're modeling, obviously positive behavior. Always including people in decision-making is important, being important, open to feedback, and then obviously championing your team. Trying to find the points of reference where you're highlighting people's accomplishment. If someone is really demonstrating a skill that obviously that they've worked really, really hard to develop, to really, really elevate that platform. And there's so many different ways you can do that. Some people like recognition in different ways. Some people don't like to get it, the shout outs in big meetings. Maybe they need more one-to-one time, but ultimately trying to figure out who's on your team, how are you connecting with them, and ultimately what can you do? So what I've developed a model called the Heartbeat Model of Leadership. And this is the consulting space that I go into with leaders, where they work through, like the acronym says, Heartbeat Model of Leadership, where they're drilling down further through one day, sometimes conferences, to leadership retreats. So at the time they get out or through the Heartbeat Model of Leadership, they're recognizing what kind of things they need to understand about their leadership to take it to the next level. So that's it for me, Daryl. And for anybody, I wonder if there's any questions that I can answer.
So I've got a question for the group. We've got about 10 more minutes, and I would love for the group to think about this question, and then maybe we can wrap it up with Roxanne, or if anybody's got questions for Roxanne. But why in the world, if we're talking about healthcare, would we be having a conversation about company culture? I know, I feel pretty passionate about this, but I would love to pose that question to the group and see if anybody's got thoughts as to why is it important to focus on the culture that the company creates for their employees in thinking about producing health through your health benefit. What's the relationship there? I got my thoughts, but I would love to just open it up and see if anybody on the call wants to share their thoughts. Jeff?
I made this comment to actually to Marlon, who Ronki and I had dinner with you, Daryl, Wednesday night of VDAR's conference. And I said, I said the thing that just came to me is that the simple message that we need to take to employers is that they have to remember that the word care, it's a verb. We have let everybody else in the healthcare space turn it into a noun. And if they don't work with us, it will continue to stay a noun. And the folks that are that are basically running things in healthcare will continue to miss the whole point of how healthcare can be used as the spearhead for culture for any organization, because it's the most personal thing that you can do. And so I think all of us can figure out how to play off of that idea with respect to the various types of things that we're doing. And so it's elemental to culture. There's nothing a CEO can do more. They all want to know how to connect better with their employees, and they struggle with how to do that. And we can give them, the platform to do that quite effectively. And I know everybody's on board with that idea, but the whole idea that care has to be a verb, and we can't let it continue to be co-opted into a noun.
Yeah. So Dave Bird's got he's on it, and I would love, Dave, you've got an amazing culture. I know how you feel about this, so I'd love to hear your thoughts about culture and how that connects with health.
To what was just being said, care is a verb, and that means somebody's got to do it. So that's people. And so the systems are great to make sure that the people line up, but at the end of the day, it gets a lot easier to get people doing the right things if they've got the right mindsets and they understand the vision and culture is around that. Just and a lot of times we take for granted that everybody's going to be into teamwork, but there are some people that work better as lone wolves, and there's other people that work better as team members, and that's a cultural thing to me.
Yep.
And so one of our very important part of our core values is succeeding as a team, but there are some projects that need that lone wolf to do what they're going to do. And but in order to, caring is a verb. There's no doubt about it. And the right people who understand, who align with the core values. And another way I see it too is the company's got a purpose, and our purpose is to make healthcare 24/7 accessible and truly affordable for everybody in the company and everybody in the family. And sometimes that means care has to be zero, right? The healthcare that we provide has to cost zero in order to make it truly affordable. And that's the purpose of the company. And that's not necessarily the purpose of everybody's life, but whatever is important to that person, we want to make sure it at least doesn't contradict and at least is inspired by the company purpose. And the more people we get who are aligned with the company purpose, their personal mission in life is aligned with the company purpose, the easier it is to create a culture of like-minded people who are moving in the same direction.
Nice. Thanks, Dave. Kristen, do you have a comment? And maybe after your comment, I'll bring it back to Roxanne. And Roxanne, I'd love to hear your thoughts on this connection between healthcare and healthcare benefits and culture. Kristen?
Yeah, so we are definitely, like everybody here, trying to change the status quo, and I happen to do it in the dirtiest business around, which is the PBM business. So we are obsessed with the customer. We're obsessed with transparency. To your point, David, it was, the people that come here are frustrated former consultants or ex-PBMers that knew the whole system was broken, and you're only at Capital if you want to change a broken system and you're willing to bang your head up against a wall that, 80% of the prescriptions are filled by 3 entities. These are massive entities. On the flip side, I was just talking to Daryl yesterday, and we changed our recent healthcare vendor. And because we're about 500 lives, 500 employees. And I was saying, as a leader, even though I don't use those benefits, I'm telling our CEO all the time, because we have Slack channels, I'm like, it's an embarrassment. Our healthcare vendor is an embarrassment. And it's not fair to do that to our employees, because we expect them to treat every person that calls our call center, because we have a lot of healthcare systems, we have a lot of unions. They are trained to treat people like family, because when people call us, they've got a prescription drug problem. And if we don't provide good benefits, I think it's a huge cultural hit. And it was an accident that we, got out here on our own, because we got to be big enough. We wanted to process our own prescription drug claims, and very few entities will allow someone of our size to, process your own prescription drugs. So we went to an entity that would allow us to do this and have the medical, and it's been pretty much a disaster. So we already know we're changing vendors next year, but that's part of the culture. And how do we expect our current employees to deliver 96 net promoter scores for clients and 91 for patients when we're not taking care of them? And so our CEO hears it loud and clear. We tell them it's on the Slack channel, but I think it's really core to, delivering a great service. And thankfully, everybody's super mission driven that came to us, and they're dealing with our first year of healthcare, the way we moved it out, and we got to fix it. So.
Nice. Thanks, Kristen. Roxanne, bring us kind of back together. And before you kind of close things up, Roxanne, I'll just simply say we've been doing coaching for 27 years. And I would say that one of the greatest hurdles our coaches face in helping people live life to its fullest is the culture within the company that they work for. So, Roxanne, you want to bring that kind of around full circle?
For sure. And in my role, prior to starting my own business, I was an executive consultant that would go into companies. And I would often sit there in the sitting to be let's say it's a new company I was dealing with. I could tell the pulse of the company by the way I was engaged. So I think that the first interaction, and oftentimes, sometimes I would sit there, in different sectors, or let's say I would go into the hospital. Nobody would know I would be sitting there to meet with the CEO or the head of HR. I could tell the pulse of what was happening by how I was dealt with or how people connected. So that I can tell you with my role as an executive or as a psychotherapist, what people need is to feel like I'm valued.
Yeah.
Who I am and what I'm about and what I believe and what I value is key. So that whole concept, if I feel seen, heard, and validated, to David's point, and I can feel like I can buy into that vision of whatever hospital organization you're in, I'm going to feel like I have that meaning and purpose in that system, right? And then I'm going to do my best to be able to give you that all. And if we think about benefits consulting, why are people utilizing it? What are they needing? And I can tell you across the behavioral health system that I worked here in Canada, which is now international, the biggest issue that people come forward for in their lives are generally not work-related. It's relationship-based. Yeah. 65% of cases internationally is based on relationships. So all of us can say that we are in relationship constantly. And generally it's around relationships at home, relationships with families, blendings of families. So that in of itself is says the importance of what we need in reference to being connected. If we feel connected, we feel better, we bring ourselves ultimately to work, and we can kind of mitigate a lot of things where people end up using benefits for the wrong reasons.
Nice. Thank you so much, Roxanne. It's my pleasure now to introduce Dr. Ronke Komolafe, who I've had the pleasure in the last few weeks to get even better acquainted with. But she has a doctoral degree in behavioral health management with a focus on integrating physical and behavioral health, and is the board chair of the Integrated Physical and Behavioral Health Alliance. And I'm going to give her a chance to maybe talk a little bit more about herself in an introductory way. But I thought having her share her perspective on how physical and behavioral just needs to be integrated is so important. So Dr. Ronke, go ahead. It's your turn. You're on mute.
Thank Thank you, Daryl, for the invitation to speak. And Roxanne, you did a fantastic job as always. And thank you everyone for joining us today. I'm excited to speak and talk to you guys about this topic. Daryl had reached out to me to talk about integrating behavioral health with employers and patients as an aspirational health model. Well, before I do that, let me tell you a little bit about myself. I have been working in mental health for the last 15 years in all aspects of mental health. Started in the mental health, working as a case manager in a clinic, all the way to working with Arizona Medicaid, and then working with Health Nets to start their first integrated health plan in Arizona and California. And then I transitioned to work in healthcare technology. So I can say I have worked in all aspects of healthcare except for pharmacy, which hopefully someday will happen. And then I decided after working in healthcare technology for 5 years to pivot and go start my own consulting after getting a PhD in integrated mental and physical health. So our company focuses on integrating mental and physical health from a perspective of a provider, a payer, a patient, healthcare technology, and a policymaker. And we'll talk a little bit about who a policymaker is, because a policymaker is also an employer, or it could be a regulatory policymaker. So my goal today is really bring this concept to you in a way that aligns with all our everyday processes, so you can have an everyday understanding. How many of you here have experienced true integrated health, where you walked into a doctor's office, your psychiatrist, your primary care doctor, cardiologist, physical therapy, chiropractor was in the same office or in the same building? How many people have experienced that?
Pretty
Never.
unique.
Not a lot. Okay. Have you ever experienced where 1 or 2 or 3 or 4 of them actually communicate with each other? No.
I have, but I use some pretty innovative healthcare.
That's aspirational health. Thank you, Daryl. So we'll talk a little bit about that, where it's not just about the provider doing that. It's also about the patients making sure that happens. So let's go ahead and get started. Okay. So what is integrated health? Here's the quick agenda. We'll talk about the history of integrated health and the similarities between integrated health and aspirational health. And we'll talk about some of the problems to solve and the benefits. So what is integrated health? In a very simplistic way, integrated health is treating the patient as a whole. It's treating the mind and the body. It's treating the mental health, the emotional health, and the physical health. So when we talk about doing that, what does that look like? How many of you here has had migraines or headaches? Anyone has had a very intense headache? Thank you, Lou. Good to see you, Lou, by the way. So if you've had that, can you imagine having an intense headache, and then for a couple of days, you probably will become cranky, may become lethargic, may end up having some mood swings as a result of that. And if that proceeds for more than a few weeks, that may become a diagnosed anxiety. So when we have those type of issues happen, a lot of times the headache may be caused by an emotional problem, stressors at work, stressors within the family, or maybe even lack of sleep. So a lot of times when we talk about integrated health, we're talking about looking at the whole. So when you treat the person, you are not just treating the symptoms, you're treating the underlying issue that causes the symptoms. So when we talk about integrated health, another perspective is making sure to the best possible way that the providers are communicating. It could be communicating through the patient or technology. It could be communicating through how the employer has set up the benefit system. It could be communicating through technology, but the communication and the collaboration between providers saves everyone money, right? It ensures that you're not having duplication in labs, duplication in prescriptions, and duplication in treatment regimen. And that is what we really mean when we say integrated health. Okay, I'm not sure why my slide is going this way, but I will manually push it. So when we talk about behavioral health, a lot of underlying issues we have in physical health has a behavioral health component. Let me give you another example. You have somebody who has cardiovascular issue, which this is a very true story. One of my best friends has a heart condition. She tends to have a panic attack. And every time she has a panic attack, she runs to the emergency room because she was born with a heart condition. And she would get admitted, they would go through series of tests and then discharge her, there's nothing wrong with you. During the COVID lockdown, the first 2 months, she went to the emergency room 7 times in 7 weeks. Every Monday morning, she was at the emergency room, she would get admitted and get discharged Tuesday night or Wednesday. By the 7th one, when she called me, I'm like, I swear this is no longer a heart condition because they keep telling the same thing. I'm like, this is a panic attack. She's like, no, the symptoms are the same, but the doctors cannot find anything. So I ended up calling her family. We did an intervention. We called a therapist and we ended up doing an assessment on her and she was having a panic attack. The panic attack was very similar to her having her heart disease symptoms, where the doctor, she calls her cardiologist and will tell her to go to the emergency room. It was just a panic attack that could have been solved with meditation. It could have been solved with magnesium or some relaxation tea. That could have been solved with yoga and some preventative measures. That is integrated health. So a lot of times when we're going through some of our life challenges, we always should look at the underlying factors affecting this. So how does integrated health affect physical health? How does it affect the cost of care? Right? We'll get to that in a little bit. But when we talk about the integrated health markets, the behavioral health markets, this market is projected to grow to over $99 billion by 2028. Why is that? COVID. A lot of people have PTSD from COVID that they actually don't know or has not showed up yet, but it's going to show up down the line. So as we are all coming in, trying to better healthcare, we should be looking at how to integrate behavioral health and integrated health into this concept. And how do we do that better? Sorry, my slides. So how do we do that better? Well, aspirational model, like Daryl and I talked about, he asked me to put some of this in, is a way to do this, right? As we're going in to talk to payers, health systems, employers, patients about how to better their care, we should be including the integrated health concept. What type of services are we bringing to the core group? Are we ensuring that behavioral health is integrated into that? Are we ensuring that they're able to take proactive measures and preventative measures such as exercise, yoga, whatever type of additional services they need for their well-being is being integrated and provided as a service? The aspirational healthcare model really focuses on going beyond the traditional measures of healthcare, which is what integrated health is. Really personalizing the care of the member, treating the member as a whole, and making it a lifestyle, right? Our emotional well-being and addressing that is a lifestyle. So I went ahead and created this to showcase a more integration between aspirational healthcare and integrated health. So aspirational healthcare focuses on alignment, right? Aligning everything you can in terms of how you access the care, the cost of care, to ensure the success of the member. Aligning the member has a choice, aligning they have the best choice, aligning the relationship building between the employer and the employees, and between the provider and the employees/patients. Now, when we talk about integrated health, we are talking about quadruple aim. And what is quadruple aim? Quadruple aim focuses on treating the member as a whole for the sole goal of lowering costs, which aspirational health focuses on, right? Patient satisfaction, aspirational health focuses on that. Clinician well-being, our doctors just want to treat patients. They just don't want to stare at computers. Staring at computers every day do make people depressed. Right now, I think I have like 20 lights in front of me just because I'm in meetings for the next 8 hours. Make sure it influences my mood. Clinicians want human interaction. We just don't want to sit in front of computers all day. Lower cost, payer wants lower cost, employers want lower cost, patients wants lower cost and better care, and health equity. If you bring this to the table every single time, it's a win-win. And the way we win this is really how we approach healthcare. Aspirational health talks about that. Integrated health talks about that. So how does integrated health, again, influence members? How does it provide better care? If you invest in integrated health in the right way, focusing on achieving quadruple aim, it enhances productivity, right? It lowers the overall cost for healthcare, both for the member and for the employer. It increases employee satisfaction. It improves corporate image. When all your employees are healthy, right, you're more likely to achieve your productivity and your goals as opposed to when they are unhealthy. A holistic care for the members, right? You're promoting a healthy lifestyle as a company. It's contagious, right? If you have a company that has, very unhealthy food for potluck every day, I've been in one of those companies. It was fun while it lasted. That's a lifestyle you're promoting. That's a culture you're promoting. But if you promote a culture of let's do yoga for lunch for 30 minutes, here is a monthly exercise to the gym pass. Anything you can do to proactively help your employees live a holistic lifestyle will influence them. Better care coordination, we'll talk a little bit more about that. How do the members coordinate their care? What have you provided as an employer, as a benefit person, or as the provider yourself to better coordinate care? How do you improve healthcare outcomes? That is a collective goal of everyone. A doctor cannot improve my health if I don't choose to improve my health, right? All a doctor can do is prescribe. I can choose to take the medication or not. Greater empowerment and satisfaction. If I feel safe and my health is okay, as a patient, as an employee, the employee will have greater satisfaction. And then at the end of the day, it's a win-win. Time and cost efficiency is a win-win for the employer, for the patient, for the payer, for everyone involved. So we talk about, again, how do we develop this? Business partnerships and opportunities, partnering with employers to help them really see how well is your system integrated comprehensively to ensure that the patients get what they need, right? Does a patient need to see one doctor here in network and then another doctor out of network 200 miles away? Or can we integrate all of this where the patients can see all the doctors within network or within the same zip code or within the same city, within the same state? How do we integrate this care? How do we achieve better patient outcome? By promoting and integrating physical and mental well-being, not just the physical health. There's so much focus on physical health. There's so much focus on, I'm going to therapy. Therapy alone does not solve issues. It helps you have a breaking point, a breakthrough moment. It helps you change your thinking depending on the modality. But at the end of the day, it's your emotional well-being and lifestyle integrated into your physical health that will help you achieve that integrated health, better outcome. How do you reduce healthcare cost? You reduce this healthcare cost by looking at the expenses. For some people, all they need is just yoga. For my friend, which bless her soul, she accrued thousands of dollars in visiting the ER every single week for 7 weeks. And she worked for a payer. She worked for a health system and a payer. And that was one of her roles, by the way, to reduce costs, but she was costing them money. When all she really needed was to go to therapy and learn how to meditate. That's the cheapest, $25 copay. And meditation is free if you go on YouTube or if you download an app. That was all she needed. So addressing the financial burden by really looking at the root cause of why someone is addressing or acting the way they're acting in order to address their healthcare. So what do we do at IBPHA? Like I said earlier on, we integrate mental and physical health from the perspective of a payer, which the payer in this case could be an employer, it could be a health system, it could be Medicaid or Medicare, from a perspective of a patient. I helped one of my best friends integrate her care. She was so focused on her heart condition, I had to bring in her mental health. in order for her to achieve better care. She has not been back to the hospital in 2 years. Integrating it from a perspective of a provider. None of the emergency room doctors thought about anxiety, but they did think about their EKGs. They did think about MRIs and all the scans and all the medications that they were giving her. None of them thought about technology. Can we even give her a wearable device so we can monitor when her heart rate is going up? I believe her heart rate or her anxiety was kicking in on Monday morning because she was terrified of not going to work. She lived alone. It was COVID. Going to work, and she had just moved to that state. Going to work was a socialization for her, not just going to work. So the idea that another week is starting where she would be enclosed in her apartment with no support, with no family, with no co-workers, was giving her a panic attack. That was really the root cause of her issue. But if she had a wearable device, she would have seen that maybe her blood pressure or her vital signs were going up the night before. She would have been able to measure that. She would have been able to talk to someone about that. So the use of technology for integrated health is exceptionally necessary. Now we can go deeper into HIE, Health Information Exchange. We can go deeper into how EHRs should be integrated into wearable devices. We can go really deep into that, but I'm just trying to, go at a high level. And then policy. When we talk about policy and policymakers, people always think regulatory policy. That is one of our areas of expertise, working with Medicaid to implement policies. We did one CalAIM implementation, which is implementing mental and physical health for the state of California in 32 counties. But as an employer, what policy do you have for your healthcare? What policy do you have? If you have a policy to save costs, how are you managing that policy? Are you measuring to ensure you achieve that goal? Are you measuring to ensure your patients, your employees are actually engaged in how the policy is working? Is that policy working for you? Ask the CFO. Who knows? So really looking at the policy and how it's written. Is it your policy to give everybody a flu shot? Or is it your policy that flu shot at the company, or is it your policy that they go get their own flu shot? What's the policy? Looking at the policy really matters. We help to ensure this policy has some integrated health aspect that truly ensures the people are proactive. So let's look at this from a perspective that everyone can relate to. So when we talk about integrated health technology, this can get complex. How many of us here has a wearable device? I'm sure a lot of people do, yes. So having a wearable device sounds fun, but imagine having a wearable device and then you have, how many of you have more than 2 doctors? And then those doctors all give you patient portals, right? I have about 5 or 6 doctors, mainly for preventative measures, and I have a patient portal with all of them. I don't remember my password for 99.9% of them. My wearable device, when I get them, I have quite a few. I get excited. I use it for a few weeks or a few months, and then I stop. I don't remember the password, but there's apps, right? So a lot of times it's nice and it's fun in the beginning. After a while, we stop using it. And these are some of the ways where doctors actually put information. So it's always nice to have a centralized location where all that information is located. I'll give you a quick story. One day I went into the doctor's office and the doctor ordered labs. He's like, you need to do this lab. Let me go write a prescription. So he goes in and comes back and he's like, oh, you had the lab 2 weeks ago. I'm like, I don't think so. He's like, no, I have the results here. Well, I had used a scheduling app called StarDoc. I was unaware, as a compliance officer, I should have been, that there is a HIPAA policy at the back end that says for every doctor I schedule through that app, all of my information is centralized in that location for any other doctor I see to be able to access, which if you had told me to sign up on that, I would have said no. But I'm glad I did unconsciously. It really worked out because this doctor came back. He was like, oh, there's nothing wrong with you. You don't have to go get any more labs. I have what I need. You're good to go. And by the way, blah, 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 blah. If you haven't heard of this, is also good. Another doctor I saw recently, that's integrated technology, right? Which I didn't even know what that app has. But my doctors at the back end are able to see that. For some people, it's really having an app on their phone. There's a few apps that gathers all your central information and puts it in there. So you don't have to remember, right? It puts in all your information. A lot of times we know what our allergies are, but we don't remember the last time we saw some of our doctors. We don't remember the last time they said some things. It gathers it in one place. That's taking control of your healthcare to integrate your care. Now, from a payer perspective, what is the cost of care? Aspirational Health is very particular about this. IBPHA is very particular about this. What is the cost of care before and after a visit, right? We should be able to find out. We should be able to know. And policies have been made for us to know. And as employers, as healthcare specialists, as benefit experts, we have access to this, and we should be able to let our patients and members and individuals know, or at least have the safe space to know that the cost of care is within their limits. And if it's not within their limits, that there are other options for them. Then from a provider perspective, we always want our members to have access to services, including preventative services. To prevent is better than to cure. To prevent is cheaper than to heal. To prevent is cheaper than to treat. We always want members to have preventative services, easy access to services, and collaboration, right? This collaboration could be through technology, like my provider did, and I went to see my provider, and then patients, right? How do we provide this information where it's not too overwhelming? An average executive has 2 minutes. Within 2 minutes, they decide if they want to talk to you or not. Within 2 minutes, a decision has been made. If they truly want a decision made, or if they truly want to engage, you have 10 minutes. And then after that 10 minutes, the brain is somewhere else. You have to keep bringing them back. So as a patient, how do we ensure, regardless of the level of expertise, professional level, literacy level, financial level, that all the patients we are communicating with, we're meeting them where they are? At IBPHA, we look at them from a generational perspective, right? As a millennial, I'll tell you, technology is big for millennials. So if my provider can communicate through text messages, including sending me information, resources from their website as a link, I'm all for it. For some baby boomers, they actually like paper. Some baby boomers love technology, depending on, what generation or how they've trained themselves to be. So truly doing an assessment of your patients before you just deploy a general process for everybody really does ensure that you have the best integrated health. And then again, policy, let's look at the regulatory policies from there. From the payers have their own policies for providers, employers have their own policies, should have a policy. Not all employers do, but they should have a policy. And regulatory policies, how is this influencing and impacting our ability to achieve quadruple aim, to save costs, lower care, achieve health equity, patient satisfaction, and clinician value? How do we ensure we can truly integrate care from a perspective of a patient? So I'm going to stop here and hand it over to Daryl.
Thank you, Dr. Reinke. We've got a few minutes, so I'm just going to open it up to see if anybody has any questions for Dr. Reinke. Anybody have any questions about the integration? So Dr. Reinke, I have a question.
Sure.
In your work, as you do with your alliance, is it mostly with health plans? Is it with employers? Is it all of the above? Tell a little bit about the work you do through the alliance, and who are generally your clients?
Thank you. So our clients are very vast because integrated health, you can bring in from all perspectives. So from a healthcare perspective, from a health plan perspective, we go in and we integrate the operational process to have an integrated health plan. It's very common to see a mental health plan on one side and an acute care plan on one side. We've come together and helped them integrate it to become one health plan. There are policies you have to write, there's technology changes you have to make. Quite a few changes have to be operationally implemented to achieve that. From a health system perspective, which a typical health system has a health plan, hospitals, provider clinics, and they're also a payer. We have come in and say, what aspect do you want us to integrate? What aspect is costing you the most amount of money? What aspect are you trying to achieve the quadruple aim? So from a patient's perspective, we have had people bring us in and say, we're just not reaching our patients. How do we achieve this? One of the most common ones we get brought in is with mental health apps or with wearable devices. People just don't use them for more than 2 months, including myself, including my staff. We've done several different marketing surveys and strategies to address that. So we come in and then we look at it from that perspective of that generation. Are you trying to deploy a Gen Z and Gen Xer app for a population of Gen Xers and baby boomers? You have to meet everybody where they are. So we help them integrate from that perspective. So and we've also done with technology. So mostly we work with those 5 aspects with healthcare technology, with providers, payers, / health systems, and we work with regulatory agencies or policymakers.
Nice, wonderful. Well, thank you very much. And again, Dr. Ronke's information, if you want to reach out to her, is here on the screen. Roxanne's information was also included. We'll have this recording available to everyone. We want to thank everyone for participating. Our next meeting with the Aspirational Healthcare Employers Group will be on August 4th at noon Mountain Time. And always open and love input on the topics that we'd like to address, the kinds of discussions we'd like to have as we try to help employers both who have applied an aspirational healthcare model as well as those who are looking to apply an aspirational healthcare model. What topics are best suited to support you in those efforts? So with that, I'll sign off and want to again thank Roxanne and Dr. Ronke for their wonderful presentations together.
Thank you so much, everyone. Thank you,
All right.
thank you, thank you.
Have a good one.
Thank you. Thank you.
Have a good
Thanks, everyone.